statistics have shown that a lot of women have lost their lives on the process of trying to get rid of a pregnancy they don't want, both single and married women, because they didn't plan for it. It came, they want to have it flushed out, or taking some measures, but local orthodox medicines is trying to just get rid of the pregnancy, even though they don't mind putting their lives at risk. What are the effects and the measures a woman should take to cope out these kinds of things? That's what we want to discuss in this video. Family planning helps you as a woman plan your life. Just like the name entails, you're kind of in charge of your reproductive life, where God takes his place. Of 100%, 98% guarantees that most family planning methods works. So there are like 2% of chances of having family planning on and it not working. I wonder how a lot of people concentrate on the 2%. Come on, that's a whopping 98% chances and just 2% chances of having it fail. You would like to be optimistic about the whole thing, that the 98% chances work for you. At least it's a better way to take that chance than take other options of maybe getting rid of the pregnancy and putting your life at risk, right? So let's talk about the different kinds of family planning method we have. In case you're watching this video right now and you don't know the family planning method you should use as a woman, you're confused about the natural family planning method, you can't track it, you can let me know in the comment section. Another type of natural method is withdrawal method. We have withdrawal method. That one, the partner can be able to withdraw before ejaculation so that you don't get pregnant. But this method is risky because a lot of people get carried away and you know what the result is. So that's it. When you know yourself and know all those things, you can easily track and maintain the pace. You can easily know when to meet your partner and when not to meet your partner. Then the artificial method is broad. That's where you have the number one, the injectables. The injectables, as the name implies, are injections. It can be given anywhere. You have the intramuscular, you have the subcutaneous aspect of them. Let me not bore you breaking down the different types of places you can give the injections, but just know that the injectables are given as injections. Then we have the implants. We have those ones that are being given just right in your arms here on your skin. Okay, you can carry these things, move about without even feeling uncomfortable, because those things are devices that have been already programmed and made comfortable to have in the body without you feeling or knowing it is there. And on that implant, we have different types. We have the one of 3 years, we have the one of 5 years. Okay, we have the IUCD, that is intrauterine contraceptive device. This one is being put into the uterus. It functions by blocking the fallopian tubes to avoid fertilization, that way preventing you from being pregnant. Mind you, family planning method prevents pregnancies. They don't remove, they prevent conception. So any other thing that somebody will tell you to do, maybe you must have been pregnant, maybe to get rid of the baby, is no longer a family planning method. Okay, so everything you're doing for family planning is before conception. These are things you do to prevent conception. Let's talk about the other methods. You have the oral contraceptions. Those ones you have to take it every day. Before it finishes, you make sure that you've provided another one. And then the risk of it is that any day you skip, or any 2 days you skip it, or a day you skip it, you have the chances of getting pregnant. So you have to take it every day. If you want to have any of the family planning method, you're likely going to be tested to be sure you're not pregnant. But in case you're even pregnant and you have them, it doesn't prevent pregnancy. That's how it works. The pregnancy will go on even with the family planning institute, because you did it when you are pregnant. And the last method I'll be discussing here is the barrier method. This one is measures taken to prevent the pregnancy from even happening. That is barrier blocking the pregnancy. Here you have the use of condoms, you have the female condoms, you have the male condoms. With all these family planning methods, if you have any question, feel free to leave it in the comment section. If you're here and you're not sure about the family planning methods that suits your body, that you could opt in for, still feel free to mention it in the comment section. Let's walk you through it. Okay? We'll see you some other time.